for the intoxication, it's this compound here. And I don't know if you can see that with the lights, but basically doing a comparison between the fed animals and the control animals, you can get all kinds of markers which indicate that there is in fact a progressive process happening. Okay, now the second example that I want to describe to you is the one that we've been working on for some time, and it comes as a result of this syndrome, which is called amnesic shellfish poisoning. And amnesic shellfish poisoning is produced by this compound, domoic acid, which is a close, as you can see, a close structural analog of canic acid, which is a drug that has been used for a long time to induce seizures in animals. Now, in 1987, and I always start off with, when talking about this with my students by saying you'll probably remember back in 1987, and of course nowadays every one of them looks at me and says, I wasn't even born in 1987. But nonetheless, in 1987, there were about 100 cases of human poisoning following consumption of blue mussels, which turned out to be contaminated with that compound, domoic acid, which in fact came from a phytoplankton bloom. And there were dose-dependent symptoms, and the epidemiology of the whole thing, as well as the neurological follow-ups, were very extensive. And so it provides us with a very rich set of patient data relating the dose of the compound to the effects that are seen in the patients, both cognitively and neuropathologically. And one of the interesting things that came out of that incident was this report of a patient who went on subsequently, not immediately, but subsequently to develop temporal lobe epilepsy following consumption of this compound. So that led us to think, okay, we and others have known for a long time that high doses of domoic acid produce seizures when they're given to animals. Okay, but the question that we asked was, what would happen if we gave very low doses, in other words, subtoxic concentrations, in the perinatal period, in other words, when the brain was still developing. And I can't go into the details, but we worked out all the dose-response relationships, and we have a rationale for when we gave the thing in terms of the relationship to the receptors that are involved. And the bottom line, and unfortunately the movie's not going to play, I tried 3 times before the session here, and it couldn't play for us, but if the movie was playing, what you would see is you would see that this is a rat that's about 4 months old, okay? This animal has been given an extremely low, immediately subtoxic dose of domoic acid during the second postnatal week of life, and it has had nothing else happen to it until it becomes 4 months old. And when it becomes 4 months old and you challenge it, in other words, you cause it to use certain brain structures, particularly hippocampal structures, to navigate in a Morris water maze, right? The animal is perfectly able to navigate in the maze, but as soon as they escape into the maze onto the platform, they start to show this very bizarre behavior, which is extremely reminiscent of what would be classified as a stage 2, stage 3 epileptic seizure on the classic 5-point seizure scale. So they show facial clonus, mastication, blinking and squinting, ear twitching. There's a forelimb clonus that you can see. And the whole thing is quite remarkable. And like I say, it doesn't occur spontaneously. It occurs after exposure to a genetic test, which is remarkably similar to the type of things that we see with many patients who have partial complex epilepsy originating in the temporal lobe. And there's a whole lot of other features. And so over the years, there's a lot of stuff here, but I just want you to realize that we've characterized this very extensively in terms of showing both neuropathological changes and neurochemical changes in terms of neurotrophin signaling, and also changes in cognitive function and episodic changes in spike wave discharges and so on in this model, all of which, or the majority of which, is quite consistent with the picture that you see in patients with temporal lobe epilepsy. Okay, so we do all that kind of stuff. And the other thing, just as an aside, is the student who actually discovered this phenomenon, Tracy Doucette, has gone on to establish her own lab, and she's actually taken a very interesting twist and looked for changes in these animals which are not epilepsy phenotype, but which occur in neuropsychiatric conditions which are often seen in comorbid conditions with epilepsy. So particularly things like alterations in attentional processing, which of course are relevant to schizophrenia and other kinds of psychotic disorders. And frequently those two things happen. And there are changes that happen there. Okay, so our initial paper back in 2004 described behavioral and neurochemical and neuropathological changes in these animals at 510 days, that's 17 months of age. They were treated when they were 8 days old, and at 17 months, and yes, you have to have a very patient graduate student to do this experiment, at 17 months of age, you have all of these changes that are happening. Great. But then the question becomes, what happens over time? If we can then back up the process and look at different time points, in this particular case, postnatal day 29 or postnatal day 90, this is data from the thesis produced by Paul Bernard in my lab, and what happens at that point? And if you do that, the bottom line, and again, I don't have time to show you all the data, but the bottom line is that you can trace out a path of changes that are happening in this model. So we now know that the drug injections are followed initially by upregulation of neurotrophin signaling systems within the hippocampus, that then increases over time and begins the process of MFS, which is mossy fiber sprouting, the formation of abnormal circuitry within the hippocampus, that process then continues on over time and spreads to other regions of the hippocampus as well. We get abnormal circuit formation and excess excitation, which then ultimately leads to cell loss. And within this process, we can also track changes in cognition, reductions in seizure threshold, and abnormal EEG activity in these animals. So using a model like this, you can start to begin to understand the sequence of events that's going on, right? Now, even in an animal model, right, you can't actually target the molecule, or it's extremely difficult to do so. So, where we started a few years ago, an extremely talented postdoc, Grossman from northern Spain, came to my lab, and she established these organotypic hippocampal slice culture techniques, which now allow us to find conditions where we can mimic in the cultures what we see in the animals. We know what we see in the animals mimics what we saw in the patients, right? And having done that, because it's an in vitro system, you can now identify molecular markers and you can manipulate the sequence and you can trace out the pathways and all that kind of stuff. And so she's been doing a series of experiments, some of which we published, some of which are in the process of being published, which basically look at a whole variety of things. We know that we can mimic the dose-dependent necrotic cell death that we see in the animal models as well, but we also want to know what's going on. I showed you that the first thing that's happening is neurotrophin signaling, so just very quickly, the one thing that we've been doing quite recently is we've been intervening at different time points using this marker of new neuron formation, BRDU labeling. And if you do that, and if you in turn follow those new neurons which are being formed, and you can see them in the white bars here, that over time there's a significant increase in the number of BRDU positive cells, which also double stain for double cortin, which means that we have a fairly robust and time-dependent increase in the formation of new neurodegenerative cells. And this is just one example of how we can tease out the molecular mechanisms that are leading to the changes. Okay, so this is the idea. These are some of the people who have contributed to the work. Basically, Descent, Melissa Perry, Paul Bernard, Daphne Gill, Deborah, who's been with me for a long time, and Annabelle, who I just introduced you to, along with a number of students. And these are my funding sources. I thank you very much for your attention. And I'm going to close just with this image of a bridge to a better future. This, in fact, is our 14-kilometer bridge, long bridge, which connects Prince Edward Island to the mainland in Canada. The advantage is that we can always sever it if we find it the rest of the country just isn't that enjoyable anymore. And we're just stick in our little paradise. Thank you very much.